Hi everyone, my name is Christina Drew and I'm a registered physiotherapist. I've been in practice for over 11 years and in the past I've been an elite athlete. I'm also a yoga instructor and a mom of 2 wonderful children. And what I've learned over the years is myofascial release is for everyone, from an inactive individual all the way through to an elite athlete. This really is a safe and effective tool for everyone to use to help increase the health and longevity of their tissues. The whole purpose of this intro video is to share with you what fascia is, what its functions are, and why it's important to apply self-myofascial release techniques to yourself. So fascia is dense connective tissue made up mainly of collagen fibers. And these fibers are arranged in a wavy pattern parallel to the line of pull of your muscle. So when looking at the bicep attaches from your shoulder to your elbow, and the line of pull or the direction of the muscle fibers is in this arrangement. So the wavy pattern of the fascia will be parallel to those fibers. And this just allows for compression and elongation or shortening and lengthening of the muscle and its fascia. So just picture it kind of like an accordion. Myofascia is a combination of myo, meaning muscle, and fascia, the connective tissue that's within and surrounding the muscle. The functions of fascia are mainly that it encapsulates and covers every muscle fiber, every muscle group, organs, bones, nerves, joints. It really interconnects one thing to the next seamlessly from head to toe. It also provides support and protection for the body. It helps with healing. It also is a storage area for fat and lymphatic fluid. It also houses blood vessels and nerves. Another key function of the fascia is that it transmits force from one area of the body to another. And this becomes really important when we talk about functioning from day to day, or especially elite athletes. There are many nerve endings that terminate in the fascia, and it's speculated that it contributes to proprioception. Proprioception is the ability for us to determine where one body part is in relationship with the rest of the body. It may also contribute to pain and an awareness of what's going on within the body. It's also functions as a lubrication or decreasing friction between one tissue and another structure. And this becomes really important because structures are supposed to glide past one another very easily. When we look at fascia, we talk about it in a tensegrity model. And tensegrity is a combination of tension and integrity. So I like using a toy model. Thank goodness I kept this toy model from when my kids were babies, but it's easily seen here how fascia kind of interrelates with every structure within the body. If we look at these struts as the bones and then the elastics as the myofascia, you could see how if I apply force to the model, the whole model gets compromised. And then if I pull the structure or stretch it, the whole model accommodates for that. And this becomes very important because it shows us how weakness in one area will cause compensation or will affect the whole model that it's attached to. So if tension becomes too weak in one area of your tissues, then another area close by or even further away from it can compensate. So I like to use the analogy of a trampoline. A trampoline has nice elastic material in the center, and surrounding that are springs with equal tension. And if it's a brand new trampoline and you're jumping on it, you're able to jump higher because of the elasticity in the material and the springs, and because of the equal tension. Now, if I were to cut some of the springs off one side, the whole material and tension will shift to all the springs that are attached. And the same happens in your body. So if you have weakness or injury in one area, another area is going to have to overcompensate in order to accomplish your task or activity. So why is this all significant? Well, because if the tissue is weak in your system, it's going to cause compensation somewhere else, which may lead to inflammation, adhesions, and even injury. Another example is if the tissue is too dense or if it's tough, then force cannot be transmitted as efficiently or optimally. So I like to use the example of a baseball player or a golfer. The movement starts at the feet and then comes all the way up the body and ends with throwing the ball or swinging the golf club. If there's a lack of elasticity or if there's issues in the connective tissue, then that force is not going to be transmitted optimally, and the end result is probably going to lead to less force or velocity of throwing the ball or swinging the club. If the whole tissue model is working efficiently and optimally, then there's better chance for injury prevention. So factors that affect the fascia. Well, research is showing that age and inactivity actually changes the structure of the fascia. So I talked about at the beginning how fascia is arranged in a wave-like pattern. When you age or become inactive, scientists have seen under a microscope that these waves now become more like lattice works, which means that there's more adhesions between the tissue. And we had discussed that adhesions can lead to friction, inflammation, or compensation in another area of the body. Other things that affect the health of the fascia are inflammation, injuries, surgery, because you're directly cutting through the tissue, healing. So when you're healing from an injury, your body's very good at bringing chemical reactions to that area to lay down new tissue. However, this new tissue is also arranged in a disorganized manner, and this can cause tension when muscles or structures are trying to glide past each other. So it's important to apply some sort of technique, whether it's manual therapy or using myofascial release techniques, to help realign those fibers so that the muscle and the fascia become more elastic. The last factor to affect fascial health is whether the tissue is hydrated or dehydrated. So because fascia is mainly made up of water, we need it to stay hydrated. And we can't just do that by drinking more water. We have to do it using a certain technique. And this technique lends itself to the sponge effect. So if you think about a sponge, when you compress it, it presses all the water out. And when you release it, it's able to pull more water in. And when relating that to the tissues, it really helps pull water, fresh water in to hydrate the tissues. Another thing that self-myofascial release technique addresses is trigger points. Trigger points are said to be small little contractions within the muscle and fascia. And the way you can kind of feel a trigger point is if you choose an area of the body, let's just say our upper fibers of traps, if you palpate around in this area, you should find a little nodule or knot, some people say. So there's not actually a knot in your tissues, but because there's a little area of contracted muscle and fascia, it feels like a little nodule or rope. And using these self-myofascial release techniques really help allow that muscle to relax. Within the videos, I'm going to be using 4 different techniques. So I thought I'd share with you these techniques so you're familiar with the terminology. The first technique is called compression. And that's just simply finding those tender areas and holding the ball and relaxing into that. And this is just general tension release and trigger point release. The next technique is going to be flushing or rolling. So you're going to see that we're going to be rolling the ball along or parallel to the direction of the fascia and the muscle. And this is going to help further break down any adhesions between the muscles and also hydrate the tissue. Another technique is cross friction. And so for cross friction, instead of going in the line of the muscle and the fascia, we're going to be going across it, so perpendicular. And this just helps further break down any restrictions or adhesions. The last technique is a self-release. So this one allows the muscles and the tissues to be a little bit more functional. For this one, you're going to add some compression to a tender area and then move that appropriate joint. That's going to allow for that muscle and tissue to stretch and then shorten. And that just makes sure that we get every little bit of adhesions along the full length of that tissue. what can you expect to feel? So if you've never had any deep tissue or soft tissue work done, or you've never used a tool such as a foam roller or a ball, you can expect to feel that these areas are going to be a little or a lot tender. It can actually be very uncomfortable. What you don't want to experience is sharp shooting pain or pins and needles. That's okay if it happens, just move the ball over slightly to either side. Congratulations on taking a step towards being proactive and increasing your tissue health and resiliency. I know you're going to enjoy these videos.